Let's jump into today's conversation or today's topic, sneak preview on possible benefits reform. Brett Kessler, the president-elect of ADA, did a podcast interview with Gary. That should have come out yesterday, meaning if you're listening to this episode on April 11th, the other episode with Dr. Brett Kessler was published on April 10th. So you would have heard some interesting news, but if you haven't listened to that podcast yet, I'll let Gary talk to you about why you should go back and listen to that. So in today's episode, we are going to be sharing some of the things that Gary talked about in that episode that perhaps would make a lot of sense for you, all of you who are interested in reducing your dependence on insurance, and of course, keeping more of the money you make in terms of all the different services you provide, especially the high value services. Gary, let's jump in.
Well, first of all, we know that many of our listeners here on the Less Insurance Dependence podcast also listening to the Thriving Dentist Show, and vice versa. Many of our Thriving Dentist Show listeners also listen to Less Insurance Dependence podcast. But some of you may not be aware of the fact that we have a flagship podcast called the Thriving Dentist Show. We publish that every Wednesday. And of course, you know, as a listener of Less Insurance Dependence podcast, we publish this one every Thursday. So recently, I interviewed my longtime friend and colleague and mentor, Dr. Brett Kessler. He is the president-elect of the ADA, the American Dental Association. He takes office of his presidency in October at SmileCon, the National ADA Dental Conference. It's in New Orleans this year. And his presidency will run from October of 2024 to October of 2025. Brett has been a longtime friend, colleague, and I am so thrilled that he will be leading the American Dental Association this next year. You couldn't have a finer individual as the leader of the ADA. Brett still practices dentistry. He sold his practice, but he works for the doctor that purchased his practice. He works an abbreviated schedule, given his intense schedule with the ADA. And Brett practiced his entire career as a fee-for-service dentist. So he certainly understands the importance of you being able to control your own fees. And he's an example of someone that was able to do that throughout his career. But one of the things we talked about in the interview, and I thought it'd be good to cross it over to this podcast because obviously it's a topic that relates to insurance. But we talked a little bit about some of his platform agenda items that he's going to be working on during his presidency. And one of those is benefits reform. Benefits reform. Now,
so benefits reform, insurance reform, right?
Like this well, I was going to go there, Naren, because benefits reform and insurance reform have some similar details that relate to both of them, but they're distinctly different. Benefits reform, for example. Let me use an example that Brett used on the podcast, the Thriving Dentist Show podcast. If you're someone that has a failing hip, let's say it's a degenerative hip condition, or maybe you're a former athlete that wore out your hip and your hip needs to be replaced. Naren, do you know anybody like that in your friend circle that had to have their hip replaced?
Yes.
It's a fairly common a joint replacement surgery, probably right behind knee replacement. Knee replacement for people that are very active or have degenerative conditions in their knees will have their knees replaced. But let's use the example of hip replacement. If you have an ailing hip, under your medical insurance will cover titanium hip replacement. So the new material that they use for that is titanium. And that's covered as a benefit. Now, it's not covered at 100%. It depends how the policy is written, but it's covered as a benefit. But now let's contrast that. So your healthcare insurance would pay for, or at least part of, it'd be a covered benefit for hip replacement. But if you have a missing tooth and would like to have that tooth replaced with a titanium implant, guess what? That's not covered. That's an uncovered benefit. So benefits reform has to do with getting some consistency across healthcare where things could be covered and considered, would mandate the insurance companies to provide benefits to those different treatment areas. And the best example is the one that I just gave. Hips ailing, get a titanium hip replacement covered, and you'll get benefits under your medical insurance.
Why is that? Is that because insurance companies don't consider like a missing tooth as the same level as a hip that needs to be replaced?
Well, I don't know. But what I do know is they've been able to get away with it, is why they do it. They've been able to get away with not covering it. And now I see that changing. Now, all of this, we're going to put a big disclaimer. All of this is to be determined, but it's kind of cool for me to think that at the highest level of organized dentistry, we're going to have a strong push to get benefits reform. I think that's pretty cool. Now, again, we'll see how that entails. Now, I don't want anyone listening to this to think that all of a sudden implants are going to be covered 100%. No, no, because there'll still be insurance reform. Insurance has to do with why they pay so little. Do you know why they pay so little on some services, Naren? Again, because they can get away with it.
Right.
And what they do, they can, like for example, Naren, I'll take a little detour here. I'm at an interesting seat at the table to see what happens when an office successfully goes out of network. Get to see what happens, and it's all over the map. For example, there are some plans that let's use the most common service that the public, the lens through which they see dentistry through, the most common service. What treatment would that be, Naren, that the public sees most commonly? What treatment would that be?
When you say the most common service that's covered?
No, that they experience, that they get. Cleaning, exam, and x-ray.
Right.
Hygiene.
Yes.
It's a cleaning, exam, and x-ray. That, by the way, is a fee that they'll be very sensitive to, because if you're an in-network provider, typically those services are covered at 100%.
Right.
Exam and x-ray, as well, as long as it fits the time limit. They haven't had one done less than 6 months ago.
Right.
And same with x-rays. There's time limit exclusions on the x-rays, but they typically, that's covered at 100%. It's one of the services that's covered at 100%.